Okay, why should we bother strengthening gluteus medius as a cyclist? Well, in another video you heard me talk about how lateral knee pain, pain on the side of the knee, is the #1 knee injury that we see in cycling. Well, that lateral knee pain is caused by excessive activity of the iliotibial band, and the iliotibial band is the muscle that's coming to the rescue when gluteus medius becomes weak. And what it's trying to do is control the in and out motions of the knee while we're on the bike. So that is far, far more efficiently done with gluteus medius, but again, it has a tendency to become weak. So how do we strengthen it? Well, this is what we call the Gluteus Medius Clamshell. And it's a fairly simple exercise in theory. In practice, it's not so easy. So the movement is this. We keep our feet together and we lift the knee up like that. Pretty simple. Now that is a very commonly prescribed physiotherapy exercise. However, I feel that we need to add a bit of a twist to it to make it effective. And the twist is this. If you put your hand on the front of the pelvic bone, there's a very pointy sort of lump on that bone. And that lump's called the ASIS, the anterior superior iliac spine. Now, below that bone are 3 tendons, and those tendons are attached to very strong muscles, and it's the pull of those muscles actually that make that bone so pointy. The muscles are the tensor fasciae lata, which attaches to this IT band, which is always such a problem. The rectus femoris, which comes right across the top of the knee here, one of the main quadricep muscles, and when it is overused, we get a lot of knee pain in the front of the knee. And then this funny kind of spiral-shaped muscle called sartorius that actually comes across and through the inside of the knee. And actually, when it's being overused, can create an awful lot of medial or inner knee pain as well. So with this one exercise, we can address outer knee pain, which is the most common, knee pain through the front of the knee, and then medial knee pain as well. So it's an important exercise. So we want to monitor these tendons. We want to have our hand on that pointy bone, in fact just a little bit below it, into the tendons that attach to it. They're kind of ropey, you can usually feel them quite easily. And the trick is, for most of us, when we're weak in glute med, as the knee starts to come up, we start firing the muscles in the front of the hip. And for people with problems, it's often quite shocking how little they can lift their knee without firing in the front. And so what would not work and what does not work is to just rattle off motions up to the top and back down 3 sets of 10, ignoring the fact that most of that movement's being done by the wrong muscle. What we have to do is change the pattern of movement, and you're going to hear this over and over again on the website as well. The problem is not just purely the weakness of gluteus medius. As a result of that weakness, the brain has changed the pattern of motion in the hip and has started to cheat. And it cheats by using too much of the muscles in the front. And if all you do is go in and lift the knee up and down, you're not going to change that pattern. You might get a bit of strengthening in the glute med, but it's not going to be, it's going to be counterbalanced by the fact that you're strengthening the muscles in the front of the hip just as much, and the pattern doesn't change. What we need to do is make glute med the dominant muscle in this motion. And the way we do that is by being a bit of a perfectionist about it. So I put my finger on those tendons to monitor to see where and when they come on. I lift my leg very slowly because you want to find the first subtle sign that those muscles are contracting. So for me, I've been doing this for a while now, it's right about here, almost to the top. Now, when I get to that point, there they go, those muscles are firing, I can feel them getting tense in the front of the hip. I'm going to back off just slightly, lower my knee just a bit, and then they soften up. And now if I hold here, what will happen quite shortly is that the bum muscle itself back here, I'll start to feel it burn. And that's that muscle doing some work. And that's perfect. And I really want to make sure it's doing the work and these ones are doing no work. Because now what we've got is a very, very good pattern in the brain. And we're generating that pattern. And as we hold it, we're repeating that pattern over and over and over again. And it strengthens the movement pattern in the brain. And that is really what the problem is the pattern in the brain has changed, and now we're changing it back. And so as we hold that pattern, we want to hold it at about 10 seconds. For the first one, I want you to hold it even longer. See if you can go 15 to 20 seconds, get a really good burn in this muscle, because what that burn is the lactic acid building up, And pain is a very vivid sensation for the brain, so it actually makes the exercise easier, because what I want you to do after it starts to burn is focus on that burn and make it burn even more. And what you'll notice is if I really zoom in on that muscle and contract it even harder, my knee will sneak up a little bit higher. And I can make it burn even more. Good, so that's about 20-30 seconds there. I've got a nice burn. I have my hand still in the front, and I just go right back to that muscle. I don't really think about lifting my knee anymore. I just think about squeezing that muscle as hard as I can. And as a result of that, my knee comes up. Okay? The most important thing is that you do not lift past the point where you start to cheat. Go up to the point, okay, I feel those muscles there starting to crack, back off a little bit. They're nice and soft, that's where I'm going to hold. Hold it 10 seconds, repeat it 10 times, and do it every single day until you can get 3/4 of the way to the top. Okay?